Hello, my name is Michael Topmiller. I'm the senior researcher with HealthLandscape, which is part of the American Academy of Family Physicians. Today, I'm going to give you a quick introduction to mapping global health. So again, I'm part of HealthLandscape, which is part of the AAFP. We have a small team that does lots of different things, but one of the things that we do, or most well known for, is creating web-based mapping tools. You can see the three areas that we work in. But again, we're going to focus today on looking at data visualizations, online mapping tools, and some of the ones that we have created at HealthLandscape. Now, why use maps and why is it important for global health? So maps are used for lots of different things, but you can see the various categories here. So exploring geographic patterns, which is important for looking at infectious disease, chronic disease, other kinds of health outcomes, identifying areas of need, layering multiple indicators, looking at can we look at some kind of health outcome at the same time as healthcare resources, also for highlighting high performing areas. But I'd say the biggest thing that we use it for, and we're going to focus on in most of this discussion today, is exploring need versus resources. So looking at those two things simultaneously. Now, in terms of global health, some of the things we're really interested in are, how does disease prevalence, incidence, mortality, how does that vary across the world? What are the role of some social determinants of health, some of those factors, risk factors that really matter, as well as looking at geographic patterns for different kinds of healthcare resources. So with that, we're going to jump into a live demonstration on some various mapping tools here. So I want to focus the first part of this, just showing you some different sites. And again, you'll have access to these links to get a sense of what's available, what's out there in terms of accessing global health data, in terms of maps. And then we're going to look at some healthcare resources, and I'm going to show you different ways to visualize some of these data. So this is the preventepidemics.org. And this is really good for identifying things happening currently in terms of infectious disease. So we think about things like the COVID pandemic is one of the major disruptions we've had in the past century or so. But every day there's different kinds of things that are coming out there. Hear a lot about mpox, but there's all kinds of other diseases that are out there that are being tracked across the globe, being tracked by different health systems across the globe. So you can see these various points, circles around the world, and you can see whether or not they're low or high risk or severity in terms of their disease. So we can scroll over here and see a low one out here. Click on this. We can see West Nile fever somewhere in the small island there as one of the lower risk ones. And then we come over here and we can see some other cholera being spread in different parts of Central America there. So cholera being a very severe disease. Monkeypox in Morocco. Again, come over here and we see cholera, a lot of cholera in Sudan. So you can scroll over these various things and get a sense of what's happening at different locations throughout the world. And you can scroll down over here and actually, select countries, select diseases, different time periods. You can spend some time on this and figure out, for your country of interest, what is going on currently in those places. We could even zoom into the US a little bit here and get a sense of what's going on and kind of near where we're at. This is in Ohio, uh, concerns around rabies. This looks like it's West Virginia, dengue. So again, different kinds of disease. Usually you don't find the more serious ones here in the U.S., but you see that there are some things that are occurring that are always happening in the U.S. as well. Now, I want to spend most of the time looking at this site here. This is the IHME website, and they have lots of different kinds of data visualizations and are a really good resource for data for things globally or within the US. So we use this site a lot when we're looking at trying to create maps, look at data visualizations, find data on various health topics. I'm going to go over here right now. It's at single by default. I'm going to explore, and you'll see a map show up here. And I'm going to expand this so we can see this map a little better. So by default, we're looking at adjusted life years, which I know you guys have spent some time on at some point in this semester. I'm going to go to deaths here, a little easier one to understand. And we can look at just death rates across the world. You can see that the bluer areas have lower death rates red areas, areas of higher death rates. You kind of see some spatial patterns throughout the world. And we come down here, we could actually modify this by year, by age groups, by sex. But we could also look at some different causes. So I know that some of the things you guys have been looking at are things like HIV and AIDS or syphilis. So we can come over here and look at some various different types of diseases, different causes to get a sense of what are some global patterns here. So you see for HIV, very much concentrated in the southern part of Africa. Come over here and we'll select to go down a little bit. I know that's something we're interested in. Syphilis, we can see how that mortality for syphilis varies across the world. So you can see some different patterns. Central Africa, Sudan, South Sudan have the highest rates. And we can keep selecting different kinds of indicators here and just get a sense of what's going on in terms of some geographic patterns. And you'll see a lot of the same kind of patterns where Central Africa, Sub-Saharan Africa, has higher rates, as well as South and Southeast Asia, some higher rates of some of these different mortality diseases for mortality for lots of these different things that we're looking at. We come down here, eventually we can find diarrheal diseases, which are much more prevalent, again, in poor countries, Central Africa. And then we can find malaria here and see some different patterns for that. I know some of you are interested in malaria. You see that the western part of Africa has the highest rates, and again, across Central Africa, and not really any other deaths or rates anywhere else really across the world. So you can come over here and you could play with this and do lots of different things with this tool. It's a really easy one to use and a really good data source when looking at global data. This next link is from the WHO. I'm not going to spend much time on this. I just want to show you they have very similar kinds of maps that you can look at. This is malaria incidence here. You get a sense of, again, very similar to the map we just saw before, where higher rates across Central Africa. But you could also look at trends across time with this, and you could choose various indicators. Again, a really good data source to look at some of the disease you're interested in for some of your areas of interest. Let's look at the next site here. Sorry, get my toolbar out of the way. I wanted to look at this is a health sites website. So if you need to identify health resources for your area, you can come here and click on your country and look at some health sites. Not the easiest site to use, but you may be able to find some resources for your country if you're having a hard time identifying some of the health systems or health resources for your country. Now, I know some students are interested in lead pollution or lead poisoning. Now, there's not a lot of good data for lead poisoning out there for really even in the US below the state level. And you may see some global data for lead poisoning, but again, it's not an indicator that we have a lot of data on. There is this website here, which is at lead pollution. So you can get a sense of what's going on. Again, the darker colors of red indicate areas with more higher rates of lead poisoning. So you can get a sense of what's going on globally with lead poisoning with this mapping tool here. You can even turn on this, whether or not the country has rapid market screening, which is important. So you can see that countries have that relative to their rates, their lead poisoning rates. You could also add different kinds of other data to see the number of children that have higher rates of lead poisoning. Again, corresponds pretty closely with some of the lead poisoning data that we have here. We can turn this off. And we could also come down here and add lead contamination sites. So you can see where those are relative to some of the areas that have the higher rates of lead poisoning. So again, another website that allows you to layer multiple indicators to explore some spatial patterns. And again, a lot of the same spatial patterns we see over and over again with higher rates in Central Africa, Sub-Saharan Africa, across Southeast Asia, and some other parts of the world. Now, I want to spend the last few minutes looking at one of our health landscape sites. So I know you've seen this before from our other videos, but again, this is just maps.healthlandscape.org. I'm going to continue here. And again, we're going to come over to our left-hand side, our tools button. We're going to turn off some of the other tools that we're not going to use and scroll all the way down to the bottom. Look at the World Health Mapper. Now, this mapping tool does a lot of the same things we just saw with some of the other mapping tools that we looked at. Continue here. With these various topics we could choose from. Key health indicators. I know you guys at some point looked at HDI and some other uh, indicators that combined multiple types of data to look at overall health for a country. And you can see that here. Again, darker colors indicate higher rates, so uh, better human development. Lighter colors indicate lower rates. And again, same kind of patterns we've seen before. We can look at mortality, life expectancy, lots of different kinds of indicators here. Um, I pulled this site up because we could look at actually different kinds of need versus resource. So we talked about the importance of healthcare systems, of having, the systems in place, doctors, other kinds of workforce, spending. So we actually can look at this site here and say, okay, where do we have higher rates of mortality, say infant mortality here, which usually is an indication of higher rates of need. Wait for this map to load. Now we see, I guess, darker colors here are areas with higher rates of infant mortality, typically areas of lower economic development, lower rates or high rates of poverty. But we come down to our tool here, we can add an indicator. And this way we can look at both needs versus resources in two separate maps side by side. So we're coming over here, we're going to come back to our key health indicators, scroll down to healthcare spending, look at current health expenditures as a percent of GDP, which basically this is a lot of this is, how much money is your country investing in healthcare. And I know that some of the notes you had in the textbook have talked about this. So you got to get a sense of, do we have high areas of need and lower healthcare spending? And for the most part, you're going to see this inverse relationship to get a sense of, yes, very much so, that these countries that are in higher need have higher rates of mortality, have higher disease incidences for things like malaria, tuberculosis, other preventable diseases, are also the same countries that have fewer health resources, have healthcare systems that are not as strong as some of the other countries around the world. The other thing I wanted to point out was changes over time. So we noticed that we still have really high rates of infant mortality here on the left-hand side in the Congo, but that have actually been cut in half over the last 30 or 40 years. So we have seen these huge declines in infant mortality and huge improvements really overall in health for several of these countries for various reasons. But we still have really high rates relative to other parts of the world. So I'm going to go ahead and end this video here. And again, if you have any questions, feel free to reach out to Dr. Visman or myself. So thank you.